Nigeria has many public hospitals, one would say.
Sadly, many are in bad shape. Dilapidated infrastructure, obsolete equipment, faulty machines, poor electricity supply, lack of potable water, inadequate funding, shortage of personnel are some of the challenges facing these public health facilities.
Patients with pay huge bills, and in most cases, laboratory and other medical facilities for treatment of cancer, kidney, brain, among others, are not available.
Well, we're talking more about this. Public affairs analyst Mayokun Ilu joins me now to talk about this. Thank you so much for joining us on TVC Breakfast.
Thank you and good morning.
Well, the state of our teaching hospitals where patients sometimes have to sleep on the floor because of inadequate personnel and even inadequate equipment to work with. How worrisome is this for you?
It's actually very worrisome. By whatever yardsticks you use to measure, you find out that Nigeria is lagging behind our contemporaries in terms of healthcare delivery for citizens. We look at the number of doctors available in Nigeria. We have about 35,000. According to the World Health Organization, we need about 1 doctor to every 600 patients. In Nigeria, the average is 1 doctor to 6,000 patients. If we look at life expectancy, in North Africa it's about 75 years. In Nigeria it's 54 years. It's a direct function of the quality of healthcare delivery. And as things stand, the primary responsibility lies with the government in terms of public health institutions. They are not delivering as it should be.
And some of the medical health personnel have said they are overwhelmed because at the grassroots, the primary health care is not really functional as it should be. Is this, like you have said, a reflection of our political will to address issues when it comes to health care?
Yeah, the problem is long in the making. It's been there since the colonial days. There is a skewed focus on the urban areas at the expense of rural areas for healthcare deliveries. That said, nobody wants to maybe stay in the village and attend to people when you can be in the town and make more money. So it's a long thing, it's something that has been there for long, and successive governments have been paying lip service to really tackling the crisis.
So where do we begin to tackle the crisis, especially when it comes to curbing medical tourism?
I think we need sincerity on the part of government. The idea of a national health insurance scheme is a very laudable one. It's been practiced in many countries around the world and it's functional. But the issue with that in Nigeria is, to date, we have less than 10% of the population being captured under that scheme. In Ghana, it's more than 70%. So where is the issue coming from? I put it at the table of government that they are not sincere enough in driving the policy into workability. If they can do that, then we see an uptake in number of people being captured under the scheme, and we'll be on our way out of the doldrums.
All right, Mayokun Ilu, thank you for your time on TVC Breakfast.
Thank you.
I have joining me now public affairs analyst Mayokun Ilu in the studio. Mayokun, good morning.
Good morning.
It's nice to have you join me.
Yeah, thank you.
All right, in the days where we had the primary healthcare functioning very well, where it takes care of preventive and very elementary things from degenerating to higher levels where you need the secondary health before you get to the tertiary. That was in the days of Professor Luke Ransom Kuti when he was Minister of Health. What has really changed between that time and now, when originally we are supposed to be more advancing now than that time?
I think the critical thing is funding. In some African countries, we have about as much as 15% of government budget devoted to healthcare. In Nigeria, it's in the range of 5%. That is not good enough for the kind of country we have. Primary healthcare is supposed to be at the rural areas and the closest to the people for basic things. But the way things are now, anybody that has any issue goes to maybe the Federal Medical Center or the major clinics in town that are meant for secondary,
Or even a teaching hospital.
or even the teaching hospitals. It's not good enough. It's not good enough. If there is enough funding and we have enough doctors and other healthcare professionals at the basic levels, we can manage most of the crisis. You know, I've interacted with many people under the NHIS scheme. The report from them is that most times when they have some ailments, they will be told that those things are not covered. On a normal day for everybody, maybe who is an adult from 30, 40 above, you're supposed to have what they call annual checks. But in Nigeria, we only go to clinic when we have ailments.
When there's an ailment.
You know,
I don't
and
think
by
that
then
is
might
part
be
of
too
the.
late.
I don't. That's not the part of culture in maintenance culture in Nigeria. When maintaining yourself and all of that, but going into allocation for hospitals and sectors or the health sector generally, we got a report about a few weeks ago where some teaching hospitals in Nigeria, patients lie on the floor because there are no beds enough. In some of them, there are no electricity. Some of them don't have water. Some of them don't have enough medical doctors to even look at or even check them and all of that. Now, the government has said they will be building about 10,000 primary healthcare centers. How would that contribute to the health issues?
It will make a lot of difference. In fact, a huge difference. With that, if you have 10,000 of those, and each one has even 100 beds, you are looking at 1 million beds, you know, and imagine just the difference. I want to believe that if government knows what they are doing, ultimately those hospitals should be skewed in favor of the rural areas. We have many hospitals, although people have to pay for them, maybe privates in the towns, but let's focus on the rural areas. They are Nigerians too. So if there's an emphasis on them, they are vulnerable in the society. You know, if there's an emphasis on them, then they won't have to come to town looking for better health facilities. And most of these diseases that are killing Nigerians can be nipped in the bud at the early stages.
Now, one of the major challenges, according to even some of the medical practitioners, is the fact that there is inadequate funding. And we know that the recommendation is about 15% of the total budget that should be when it comes to funding the health sector. But then we don't have that. But some other persons have argued that even if we give about that 15%, that is not the challenge. That more funding is not the challenge here.
More funding is the challenge. It's critical. It's not the only one, but it's about the most critical. If you spend more money, you can hire more doctors, you can build more hospitals, you can have more coverage, you know, between the cities and the rural areas.
But there has been some allegation of corruption when it comes to proper execution of the budgetary allocation.
I wouldn't go there because you have corruption if there is no enough allocation of resources. If you have enough resources, you can now pinpoint where the corruption is coming from. I will agree with you that the NHIS has been fraud with maybe corruption claims as they were, you know. But that said, I believe in models as an economist. I look at what is working in other climes. How can we domesticate them? If Ghana can have coverage for 70% of their citizens, why should we be struggling with less than 10% here? If we need to send people to Ghana to go and learn.
But have we shown the political will to address whatever the corruption is when it comes to that total coverage of even up to 50%?
If I narrow down corruption, I will tell you the political will is because those who are leading us don't feel the need to be part of our experiences. The idea of medical tourism consumes about $1 billion from Nigerians annually. Most of them are people in public sector who are high up in the chain, and people who can afford it, not the people low